Thank you, Dr. Plabita, for giving me this opportunity to share my experience of last 20 years with you all. It is indeed a great pleasure and privilege to be present in front of you all and to be in this platform. Today I will be discussing common health related issues of women in day-to-day life. You can see in the background Kakrapar Hospital where I am presently working. You are aware that a woman take care of each and every individual of their family, but they are the last to take care of themselves. But things must change. There is a saying, if we educate a man, we educate an individual. If we educate a woman, we educate a whole family. Let's do it. There is another saying, a healthy woman leads to a healthy family, and a healthy family leads to a healthy nation. My sincere request to each and everyone viewing this presentation is that whatever you learn from this presentation today, go back to your society, go back to your family members, go back to your friends and spread the word of awareness so that more and more people are aware about their health related issues and we can build a healthy woman, healthy family and a healthy nation. My tribute to Assam Medical College, Dibrugarh, where I did my MBBS as well as MD. Common health problem which I will discuss today is anemia, menstrual problem, polycystic ovarian syndrome, pelvic infection, menopause and cancer. Anemia, very common in India. Every second patient who comes to my OPD is found to be anemic. It is more common in children, adolescent, pregnancy and lactation. It is seen in both sexes. Just see in the chart, the normal value of hemoglobin which is required in man is 13, woman is 12, in pregnancy it is 11. But hardly you will get women in pregnancy with 11 gram of hemoglobin. Let's now discuss what are the causes of anemia. There are some conditions where a lady needs excessive iron like pregnancy and lactation, excessive loss of iron during heavy mens, decrease intake if you are having a vegetarian diet, decrease absorption if you are continuously taking antacid medications which reduces the HCl hydrochloric acidic environment of your stomach, then iron absorption will be less. Signs and symptoms. What are the symptoms of anemia? It affects your day-to-day activity. Any slightest exertion will lead to tiredness and fatigue. There may be leg cramps, there may be giddiness. Consult your doctor as early as possible because a simple hemoglobin test will detect what is the level of hemoglobin. When you visit a doctor, there are few signs which the doctor will see and roughly estimate the level of hemoglobin. Non-pharmacological management of anemia includes you have to reduce the intake of tea and coffee as it inhibits the absorption of iron. Moreover, you have to increase the intake of vitamin C containing fruits as it helps in the absorption of iron. We also advise exclusive breastfeeding for 6 months and after 6 months till 2 years of age, you should supplement iron rich food for your baby. Treatment part will be dealt by the doctor. They will prescribe anti-worm, iron tablets, injections and sometimes blood transfusion may be required. But don't stop the medication immediately because it has to be taken for at least 3 to 6 months as advised by your doctor. And whenever you have any problem taking iron medications, it can be switched to other preparation. Different preparations of irons are there. Iron is there. It can be switched over. But continue the intake of iron as advised by your doctor so that your hemoglobin improves and you feel better in future. Now let's discuss a very common issue of women, menstrual problem. What is a normal menstrual cycle? During a normal menstrual cycle, a lady will have a menstrual phase, pre-ovulatory phase, ovulation and post-ovulatory phase. Everyone will agree that each and every lady in this universe is having a different cycle of time, duration and flow. What should be the characteristic of normal menstruation? A girl must attain her menarche at the age of 10 to 16 years. Average age is considered to be 13 years, but nowadays we are finding that girls are getting their menarche earlier. Students of class 5 and 6 also are getting menarche. Therefore, parents of a girl child must inform her child with the right information about menarche, menstruation in their life. Second thing is the duration. If it is less than 2 days, we used to call them it is scanty, and if it is more than 7 days, we used to call prolonged period. If we see by the amount of bleeding, 30 to 80 ml is considered to be normal, but it is very difficult to assess like that. We normally ask in our OPD by asking them how many pads they are using during the menstrual cycle, which gives us a rough idea whether her flow is normal or not. But every lady is aware of what is normal or abnormal in her cycle. 30% of ladies during their reproductive age will suffer from menstrual irregularity. Extremes of age, they have more chances of irregular menstrual cycle. I mean to say, just after menarche, as the track from brain to the end organ, ovary, is not matured. And the later part of life, that is just before menopause, she will have 4 to 5 years before menopause, she will have irregular menstrual cycle. What is abnormal? Intermenstrual bleeding. If flow is heavy, if you are passing clots, if the duration of flow is more, immediately contact your doctor, visit your doctor, so that he can find out what is going on. Another common symptoms with which a lady present in our OPD is premenstrual syndrome. A lady feels tired, fatigue, headache, irritability during this phase. Contact your doctor as early as possible so that you can feel better. There are so many causes of irregular menstrual bleeding. Therefore, sitting at home, you cannot find out why you are having irregular menstrual bleeding. Visit your doctor so that he will find out what is the cause. Next common problem with which a woman attends our OPD is polycystic ovarian disease. Polycystic ovarian disease syndrome is the most common abnormality, metabolic abnormality of young women of this generation. It causes infertility in the reproductive age, and the incidence of polycystic ovarian disease is going high day by day. If you can see the incidence, it varies from 3.7% to 22.5% in some areas. We diagnose a lady to be having polycystic ovarian disease if out of these 3 parameters, 2 are present in a lady or a girl. If she is having scanty mens, oligomenorrhea, if she is having oligomenorrhea and amenorrhea. Amenorrhea means absent mens for 3 to 4 months. If there is a lab criteria which shows that her androgen level is very high and insulin level also is very high, and in ultrasound we find that there are polycystic ovaries are seen in ultrasound. Out of these 3, if 2 are present, we diagnose the lady to be having polycystic ovarian disease. Clinical presentation. It varies in different ages. In adolescent age, it will be different with menstrual irregularity, hirsutism, acne. In the reproductive age, it is infertility, miscarriage, and in the later part of life, endometrial hyperplasia and cancer. The main cause behind all this is hyperinsulin level and hyperandrogen level, which causes ovulatory dysfunction and finally leading to obesity. The metabolic consequences of this polycystic ovarian disease is a lady become pre-diabetic, she become diabetic, and she is more prone for cerebrovascular disease and cancer in future life. Obesity is commonly seen in polycystic ovarian disease. 50% of girl or women will have obesity. But we have seen lean patients also with having polycystic ovarian disease. You can see the slide: hirsutism, excessive hair growth, facial hair, acne and baldness, male type of hair growth, acanthosis nigricans. This is due to hypercholesterol in her body. All these metabolic factors leads to a condition called metabolic syndrome. She becomes diabetic, she has hypertension, she has cholesterol problem, and finally leading to cancer, which is called metabolic syndrome. Two types of obesity can be seen here: apple type and pear type. Both are not acceptable for a healthy life. This is just to show you the necklace pattern of polycystic ovarian disease in ultrasound. The cyst in the corner of the ovary showing the necklace pattern. This is in laparoscopic finding where you see pearly white smooth ovaries. Treatment of adolescent girls with polycystic ovarian syndrome is very important. In adolescent group of girls, our treatment is targeted towards regularizing her menstrual cycle, treating her acne, hirsutism. We can also guide them for a proper and healthy life so that the long-term consequences of insulin resistance, cardiovascular risk, and malignancy risk can be prevented in future. Management part deals with lifestyle management, weight reduction very important, waist to hip ratio very important, diet management and hormone therapy. A balanced diet plays a very big role in adolescent PCO management. Therefore, she should maintain a high degree of discipline in what to take and what not to take, as shown in the food pyramid in the diagram. My advice to all the adolescent girls with polycystic ovarian disease is that maintain a healthy lifestyle with balanced diet, have plenty of green vegetable, do physical activity, go out for 30 to 45 minutes for jogging, cycling, anything you like. Cut down the level of junk food. All these things will give you a healthy and happy future life and make your menstrual cycle as well as other problems associated with polycystic ovarian disease less. Another very common cause with which a lady comes to our OPD is pelvic infection. Never neglect your symptoms of white discharge and itching. The earlier you attend the OPD, the shorter is the duration of treatment. But if it becomes chronic, it takes time to get cured. And if you are getting frequently pelvic infection, we need to treat your partner also. Other than that, another urinary tract infection is also very common in ladies. This is due to the anatomical proximity of urethra with vaginal orifice and the anal orifice, and the length of the urethra is shorter in female. Moreover, you get menstrual cycle, and blood is a rich source of growth of bacteria. And the cleaning pattern of perineum also helps in the growth of bacteria in the urinary tract. My advice to all the ladies who have urinary tract infection frequently in their life, frequently change your pad during menstrual cycle and change the pattern of cleaning your perineum. That will help in the long run to avoid urinary tract infection. Another important phase of life in women is menopause. It is your change, it is your life, you have to take charge of it. It is a normal part of aging, but it is sometimes very challenging for many women. You must take charge of your transition. You must gather accurate knowledge of the various changes which is happening in your body so that you can navigate your transition phase smoothly. It is a phase of life where there is hormonal, physical and emotional change. In this phase of life, we call emptiness syndrome because children are grown up, they are far away from their parents and emotions are very high. The age of attending menopause in each and every lady varies. It is considered to be between 42 to 56 years of age. And we consider a lady to have attained menopause only if she has not got her cycle for last 1 year. It affects each and every organ of your body because of your reduced hormonal level, estrogen and progesterone, starting from brain to ovary. Hormonal changes will lead to hot flashes, irregular period, vaginal dryness, loss of bone, osteoporosis, mental functions, sexual desire, sleep disturbance, joint discomfort. Every second lady will have different type of symptoms due to change in menopause. I like to stress upon osteoporosis. It is a silent killer. There is reduced bone mass. Because of reduced bone mass, a sudden fall can lead to fracture. Therefore, it is said that make your bone strong, make your bone matrix stronger during your teenage and adolescent till 30th of age. Because after 30 years of age, slowly the bone mass reduces, and after menopause, the amount of reduction in the bone mass is faster. We say it, you should deposit it like a saving bank account. You should have enough calcium and vitamin D3 during this adolescent period up to 30 years of age. Then only you can overcome the degradation part of bone mass because of hormonal changes in menopause. I would also like to stress upon vitamin D3. Nowadays it is very common deficiency disorder in India. 90% of patients who attend our OPD, you will find that they are deficient of vitamin D3. It is called a sunshine vitamin and it is synthesized when we are exposed to sunlight. As like half an hour of exposure of our arms or limbs in sunlight causes synthesis of vitamin D3. But you must be aware that the amount of the wavelength of sunlight which is required for synthesis of vitamin D3 reaches between 11 am to 2 pm when the intensity is high. But due to our lifestyle modification in day-to-day life, it is hardly we are exposed to sunlight for half an hour we use sunscreen, we are indoor, we use air conditioner, therefore we are deficient in vitamin D3. Coming to cancers, cancer of the breast is very common. 1 out of 29 women is having breast cancer. Family history plays a big role. If your mother, if your sister is having cancer of the breast or the ovary, you have a chance of getting breast cancer. If you are getting late marriage, you have a chance of breast cancer. If genetically it is found that you have a BRCA gene 1 and BRCA gene 2, as you are aware that Angelina Jolie she removed her breast as well as ovary because she found herself to be positive of this gene. Self breast examination. Each and every girl, each and every woman must learn this art of doing self breast examination. They should do after mens, and monthly they should do it. Once you do monthly, you will know the texture of your breast, and if there is any change in your breast, you can find out. Here I am showing the part of the pump which is used for breast examination. If you find anything, immediately contact your doctor. Mammography. We advise mammography between 40 to 59 years of age yearly. After 54 years of age, 2 yearly mammography is advised. But in conditions like if you are having a family history of breast cancer or ovarian cancer, it will be advised frequently or yearly. Don't panic if you get a breast lump while examining, because 90% of breast lumps are benign in nature, but must consult your doctor as early as possible. Next common cancer is cervical cancer. Burden of cervical cancer. 1 out of 4 women who dies of cervical cancer is an Indian lady. It is caused by a common virus called human papilloma virus. You see the incidence is going high day by day. Here I want to emphasize that cervical cancer is 100% preventable and treatable if it is detected at the earliest stage. And it can be detected by simple test of pap smear. And I know a lot of people are scared what is pap smear, how it is done, whether it is painful. Pap smear is very simple test. I do believe each and every woman must have attended a gynecological OPD and must have been examined by a doctor once in a lifetime. They use a small instrument called speculum just to see the lower genital tract. Same thing is done while taking pap smear. We put a speculum and just take the discharge from the vagina and the cervix. It is absolutely painless. Therefore, don't be scared of pap smear test. Go ahead for pap smear for a prevention of cervical cancer. We have another very good instrument in our hand, that is vaccine for cervical cancer. 2 vaccines are available in India. One is Gardasil and Cervarix. I do advise my patient, gift your child on your 9th or 10th birthday cervical cancer vaccine, because our target population is 9 to 21 before first sexual intercourse. 3 doses are taken if your girl is taking after 15 years of age, and if it is below 15 years of age, only 2 doses are required. In foreign countries, they have included cervical cancer vaccine in their immunization schedule, but in India, you must purchase and get it. Coming to my last slide, it will be very difficult for you all to remember each and every word which I have spoken in last 30 minutes. Therefore, in nutshell, I'll give you some take-home message. Always give 30 to 45 minutes every day for exercise. Make it a habit, like brushing your teeth. Without brushing your teeth, you don't go for sleep. Without brushing your teeth, we don't go to office or workplace, because it is a habit. Inculcate the habit of exercise in your day-to-day life. You can do 5 days a week. 2 days you can take rest. But how to do it? How to make it a habit? Studies have shown that if you do it for 21 days, it becomes a habit. So try it for 21 days and inculcate the habit of exercise in your life. Always remember about pap smear test and gift your child with HPV vaccine for prevention of cervical cancer. Though cervical cancer is the commonest cancer in female, don't forget about ovarian cancer, breast cancer, and uterine cancer. Do an annual health checkup by a gynecologist every year so that you can check your hemoglobin level, get an ultrasound done, so that so many things can be detected at the earliest. Last but not the least, prevention is always better than cure. Lastly, I am thankful to each and everyone viewing this presentation for giving their half an hour. Hope it will help each and every one of you for living a healthy and happy life in future. Thank you.